Hello, thank you for hanging in there with us. I know it's been a long day. I've been with you all throughout this training, and Dr. Okeki and as well as Ashley have really laid down the framework and the foundation for me to present on the social determinants and social needs screening. So I'm going to breeze through this, so bear with me. That's me. So a couple objectives. We're going to define social determinants of health, understand determinants that may affect a patient's health, describe tools that healthcare workers can use to help patients and their families access needed resources, and be able to help patients prepare for their medical visits as well as talk to their doctors. And again, if you can rate your knowledge on the following, 28 to 30. So social determinants of health is quite a public health buzz term. And basically, it's defined as the conditions in which people are born, grow, live, work, and age. It further states, the World Health Organization states that these circumstances are shaped by the distribution of money, power, and resources at a global, national, and local levels. So the why, the impact of social determinants of health. Some of you probably have seen the iceberg, that you see the tip of the iceberg at the clinic visit. However, there's all these underlying factors, and 40% of what impacts your health and well-being is social economic factors. And so examples are education, job status, family social support, income, community safety. Only 20% is access to care and quality of care. So it puts things in perspective. Social determinants of health. A couple examples are early childhood experiences. Some have heard adverse childhood experiences known as ACEs and their development. Social support and community inclusivity, crime rates and exposure to violent behavior, which creates these post-traumatic stress disorder, other factors that show up physically and mentally. Availability of transportation, that's a big one here, especially in Wicomico County. Neighborhood conditions and physical environment. Access to safe drinking water, clean air, and toxic-free environments. Recreational leisure opportunities. So how healthy is your community? I give you homework. You can definitely you can click on the link and you're able to see the county health rankings in the state of Maryland. And it's really shocking. Wicomico is actually rated 19 out of the 24 counties as the worst in health indicators and worse in health rankings compared to other counties. And Baltimore City is the last one, number 24. So you're able to compare which are the health factors. And a couple of that I saw were childhood obesity and adult obesity, and as well as poverty. And so those, you can go into deeper dives and look at the numbers and the statistics so that you can prepare yourself, especially when interacting with some of the patients, going into their homes and whatnot. Here's Ms. Alexa again. So we're going to focus on the social profile. So she's a retired widow who lives alone, and her son lives 5 hours away and uses public transportation. Has a high school education, worked as a kitchen staff in a school cafeteria on a fixed income. She has no fresh food at her home due to her recent stay for 4 days in the hospital. Experiences other care transition challenges such as off-road options, snapshot treatment, diminished ability, and increased responsibility. Again, her personality behavior profile, she's an extrovert, usually lively, people person, and does not like to be alone. Enjoys attending group meetings when she can, does not exercise as much, and tries to maintain good eating habits. She engages well with her peers, encourages them through life challenges. So a question for you all is, I'm sure you've seen Ms. Anexa at your practices. What skills and abilities does Ms. Anexa possess? I'm sorry? People skills. She has great interpersonal skills. She worked as a kitchen staff, so I'm sure she's used to seeing all types of people, interacting with them. Anything else? She's able to use public transportation. That's a big one. And that's also very empowering. I know that in different social needs screening, you always ask, like, do you have any difficulty getting to your medical appointments and transportation? Of course, they're going to say yes. So what I typically ask is, how do you usually get to your medical appointments? And then they tell me, like, oh, my friend drives me, that kind of thing. which social needs are of high priority to address first?
Barriers to obtaining medications.
Medication. How about food? So she had a recent stay and she may not have food, or like the food may have spoiled, or that it might have expired. Anything else?
It would kind of be what is most important to the patient. So roof over your head, utilities, family, whatever's.
She mentioned utilities. So always asking, what is your pain point? What is the most pressing need right now at the moment? Because we listed this behavior profile and personality profile, but there might be some underlying things that she may disclose. What might go unaddressed because of misannexed social needs? How about transition of care? How about making sure that, and I know they mentioned earlier, home health, making sure that she is able to, maneuver in her household? Or how about if it's happened to be open enrollment period and she has to elect a Medicare Part D plan? Those things may go unaddressed if you are not mindful. And of course, if you're addressing all these pressing needs, it might just go, on the lower the priority. Anything else? MDPCP requirements, social needs. It's under the comprehensiveness and coordination, so practices should complete an assessment of their attributed health and health-related social needs, conduct an inventory of resources, and support them in the community to meet those needs. Practices are to utilize health-related social needs screening tools, and I'll give you some examples. So this is in your folders. I know there's a couple of swim lanes, but I just wanted to focus because Ashley did a great job in kind of explaining the type of outreach that can be conducted. And again, CHW home visits can be prioritized at the primary care doctors or the care manager's request for patients that the practice is unable to reach, depending on the type of outreach that they do, text messages, calls, robocalls, and they're still not able to get the patient. That's when home visits can be prioritized. For patient safety issues, if they're at risk for falls, and so you want to go and assess their home and do a home safety evaluation. For patients that need in-person assistance in completing applications, such as, I'm thinking about like local transportation, local health department transportation, that kind of stuff. For patients without a face-to-face contact in 3 months. So those are things that, again, you can tailor based on the needs of your practices, and of course, depending on the availability of the resources that you have. But I know that they mentioned earlier that they might have some home visiting programs or you can definitely tap into resources in your community as well as in your practice. And then moreover, these assessment tools, depending on the EMR you use, can be configured or integrated in the EMR, and I'll give you an example as well as that. So that could be something that you can as well advocate on your level. All right, examples of screening tools. So CMS has the Accountable Health Communities Health-Related Social Needs Screening Tool. It can be self-administered. There's a short one and there's a long one, depending on the time and the need. You can tailor it that way. The American Academy of Family Physicians tool also has one that's 11 questions that is offered both in English and Spanish for Spanish-speaking populations. And then Prepare Toolkit also has a screening tool that is 15 core questions and then supplemental questions if you want to go for a deeper dive. So this is one of my favorites, is the Impact Community Health Worker Outpatient. It's called the Outpatient Meet the Patient. I'm sorry, the Outpatient Meet the Patient interview. And what I like about this is open-ended questions. And so it basically says to the patient, like, tell me about your health, like those questions, and let the patient tell the story. And then you're able to, complete your whatever screening tools that you have and complete it based on what the narrative is and how the patient presents themselves. All right, tools and inventory resources. Again, you can tailor it to the needs of your practices and of course the population, but a few ones that are free is United 211, Aunt Bertha. Has anybody used Aunt Bertha? Okay, it's a free database. Again, you can encourage your patients as well to to create a profile, and you can favorite some of those resources that you use that are reliable. Of course, your electronic health record, your local health department, Maryland Access Point. You can always keep up with some of these new programs, like I discussed, and also develop, a virtual binder of resources and share with your staff. And that's basically the last point. What services or resources are available in your primary care practice to address social needs? Anybody has created a resource binder, or I see a couple nods. Anything that is on top of those resources on your list?
The MAC Center, which is a senior resource center, they have a directory. It's a published directory as well as it's online.
Okay, great.
So that covers at least the lower 3 counties in this geographic region.
And you said MAC? Is it an acronym?
MAC.
Oh, okay, MAC?
Maryland Access Point.
Oh, okay. Oh, okay, so Maryland Access Point, or is it Maryland Access?
Yeah.
Yeah, it's
Maryland Active Citizens?
it's what,
Maintaining active citizens.
yes.
Maintaining Active Citizens. And there's so many acronyms.
Yeah.
Yeah, so I know. Definitely Google. I'm sure you said that it's available online. So in case you don't have those resources, it provides a directory that is.
And they have a newsletter.
And they also have a
They
newsletter.
have
I know.
classes and senior support actually physically at the center.
And I know, I come from Baltimore, but they have the Beacon. I don't know if they have it here. It's like a senior citizens newsletter. Sometimes you see it in like senior centers and also grocery stores, depending on where you go, where it also lists a couple of resources there for that community. Anybody else has?
President has a commission on aging.
The Commission of Aging as well. And also tap into definitely the Department of Aging, Commission of Aging. They also, depending on when you get them, especially in the beginning of fiscal year, they may have some programs out there that could benefit some of these patients that we're serving every day. All right, so establishing home visits. I'm not gonna go too deep into this, but basically, this is part of the PDSA. Set your aims, establish what is the purpose of the home visit, and you're able to determine what these measures are, the number of home visits, the number of needs assessments completed, social needs identified, the social interventions and how that looks like. This is really important, is establishing a protocol for home visits, including the safety, staff safety, and how it communicates. Communication is important, especially when doing home visits. Establish a protocol for addressing social needs. If you already know that there's a transportation barrier, especially in my experience, what I always try to do is empower the patient as well, is tap into those local resources. And if local health department can't get you there, or MTA mobility or county ride, I'm not sure what it's called here, but if they can't provide you transportation, then we can go up a level depending on the need. And again, you're able to capture reporting. Everything you do, you have to be in the mindset of, is this reportable? So basically, you want the care coordinator and the community health worker to be able to document some of these interventions. And of course, for continuity of care purposes, you don't want to duplicate services. And so this is an example of a social needs screening that was configured with an EMR, an Epic, and you're able to see visually, some of the social needs, and you're able to also capture the reporting, as well as when that barrier became not a barrier, or when it was completed successfully, and you address these food insecurities, for instance, and income. All right, preparing Miss Alexa for the doctor's visit. So according to National Institute of Aging, the average time a doctor waits before interrupting a patient is 18 seconds. So you definitely want to empower some of your patients. And I know this happens to me all the time, but you want to prepare them with a list and prioritize your concerns. Take information with you. Consider bringing a family member or friend. Be sure you can see and hear as well as possible. Again, capture some of those cultural linguistic needs as well, because again, if you're doing outreach and you're sending letters, some of them that may be visually impaired may not see the letters. So make sure it's large font depending on the need. Plan to update the doctor. Request an interpreter if you know you'll need one. Again, Title VI of the Civil Rights Act, 1964. Literally, it's their legal right to request an interpreter if they are not able to understand, especially for those recipients of federal funding. So it is their legal right. Okay, discuss concerns with your doctor and tracking your medications. Again, these are just examples of tools that you can give to the patient so that they can keep track, or if the community health worker is there to assist them in completing it, they can. And here is an example. All right, sorry, I'm breezing through it. So share experiences with using any worksheets or anything that you do to prepare the patients for their upcoming visits. I know that there was medication filling at one point.
There's another thing that I learned like when I took undergrad classes is asking free. So there's 3 questions that you can ask them. I think they're for you. The first one's like, what is my main problem? The second one's like, what do I need to do? And then the third one's why is it so important for me to do this? It's like the main questions, yeah.
Yeah, and that's giving also them power, right? What do I need to do? That's perfect. Did you hear that? Maybe I should. Yeah, repeat. Okay. Here. You can speak into the mic.
Yeah, so you can actually look this up. It's Ask Me Free. So the first one is what is my main problem? The second one is what do I need to do? And the third one is why is it important for me to do this?
Talia, always top score. What about visits with their specialists? So of course you tailor that to their specialist, of course, and you can definitely assist them with that. I'm thinking about like CHF patients with cardiologists. There's certain things that they want to know, their weight in the morning, those things. And so you're able to, again, you can customize these worksheets. You make it color coordinated, you can make it bright, whatever it is that you have to do that really, and that's part of like also how do they learn. If they like are visual learners, then maybe that might help them. So customize it depending on their needs. And then session recap. Again, the SDOH, we went over that, some of the practices that you should complete an assessment, social needs, and conduct an inventory. And again, all of this is to address Ms. Anex's needs and connect her with those resources that are again reliable and dependable. And that's another thing is that I want to focus on, like, of course, when I'm training the community health workers, I always tell them, make sure that you're providing them with direct referrals and not give the patient that 1-800 number and they have to like select one, select two. Try to get them a real person because they oftentimes become so discouraged if you just give them a paper or a flyer or a 1-800 number. So it's best to like really give them that contact person that you know is reliable. All right, post survey. Thank you for your time.